Developments in Medicaid expansion talks at the state capitol turned a corner today as Senate conferees provided the House with their counteroffer expansion plan. Now, we have team coverage with 12 News' Byron Brown and senior political correspondent Richard Lake. They join us live now from the state capitol with more on the day's developments. Byron?
Melanie, it has been a very busy day here at the state capitol, really a busy week when it comes to Medicaid expansion. A lot happening here at the state capitol on that issue. The House gave out their compromise plan earlier this week, the Senate today, but also other developments on education, too. We're going to talk about both those issues, but we begin with Medicaid expansion and our senior political correspondent, Richard Lake. And, Richard, a lot going on today on a Friday here at the state capitol. But Medicaid expansion, really, the Senate moving off of with that number of dealing with the working poor, for going from the 99%, and they moved up on that number. Talk about that.
Yes, the federal poverty level. They matched the House. They are at 138% of the federal poverty level now. The measure that they passed earlier this year was dubbed expansion light. That only expanded up to 99% of the federal poverty level, and now they have that same number between both chambers, expanding up to 138% of the federal poverty level. Now, the work requirement that's listed in both plans will also play a huge role in negotiations moving forward. The Senate has a very strict work requirement of 120 hours a month, while the House is at 20 hours a week. The federal government has not approved a Medicaid expansion plan with a work requirement throughout the entire Biden administration, yet it is included in both the House and Senate expansion plans.
Work requirements are there. The exceptions are still in there. We put a little bit stronger language if the bill should be CMS denies it, then the department shall file a lawsuit along with the assistance of the Attorney General.
We heard from our House colleagues that a work requirement was absolutely essential. We have so many working Mississippians right now that don't have any coverage at all, and this would really close that coverage gap, get those working Mississippians to get health care, and that's what we're really focused on right now.
The work requirement was in the House plan, and that's where we are. That's where we are both in the Senate and the House.
Now, the House can either sign on to this compromise, amend it, or reject it.